Welcome to the World Mental Health Day 2021. Living Mind, in collaboration with Sangeet Foundation, we are delighted to bring this live event. So, thank you to all our viewers and listeners. Today's theme, or this year's theme, is mental health in an unequal world. So, we do know that we have unequal access to mental health care across the world. It also sometimes gender, social class, race, culture, ethnicity, just to name a few. These factors do contribute a lot when it comes to accessing the mental health services, particularly when we need them. So, what would be our role in the community and the role of the professionals? I was just going through some latest survey and research. The World Federation of Mental Health, their survey suggests that people with mental illness in the low and middle income countries, 75 to 95% of them are unable to access mental health service at all. That's a staggering statistic. We need to do something about it. More recently, COVID pandemic made it even more obvious. So that will be our theme today. So we have a fantastic lineup of guests from diverse backgrounds, different professionals. Some of us are in mental health, some of them are in the community. And we do have a surprise guest at the end. So please do tune in, stay in, leave your comments, and your feedback is absolutely vital for us in moving forward. We all have a role to play in the community. So without further ado, let's watch a little video from Living Mind.
My name is Sarkhel. My husband, Dr Arghya Sarkhel, and I co-founded Living Mind, a private mental health consultancy. We are very grateful and glad to share that we have helped many people with mental health illnesses.
So our aim remains not just to control or treat their symptoms, but make sure that improvement in their mental state leads on to an improved functioning in their social life as well as in their occupational life.
We treat a range of mental disorders: depression, anxiety, OCD, ADHD, eating disorder, schizophrenia, addiction, and many more. We specialise in assessments for dementia. Our online video consultations are safe and secure.
We specialize in RTMS, repetitive transcranial magnetic stimulation. This treatment has helped many patients recover from severe depression, anxiety, OCD, and many other mental illnesses.
Please visit our website livingmind.co.uk, where you will see the details about RTMS. And if you're interested to know more, please do not hesitate to pick up the phone. I'm more than happy to discuss and talk you through over the telephone before you make the appointment.
I've had depression on and off since I was about 13 years old. I've had various spells of treatment for it and taken various different medications for it. This year has really been the year I sort of said to myself, I have to, acknowledge this and try and do something about it. I wanted to find an alternative to antidepressant medication because I found they came with some quite serious side effects. Not for everybody, but for me, I found that it wasn't really working for me, so I wanted to have a drug-free treatment. And that's how I came across RTMS. I've definitely noticed there has been quite a strong effect after each treatment. So there has been some times where I felt pretty depressed going in, I hadn't really been doing anything, not really talking to anyone a lot, not really sort of looking after myself properly. And then I've gone in, had this treatment, and kind of immediately felt, more cheerful. I also noticed that maybe it sounds a bit strange, but I could sort of appreciate music a bit more deeply after I've left a session. I think it definitely has been a good thing overall, and that was one of the things I wanted to do. Like, I came off medication when I started having this treatment. So yeah, that's pretty, I suppose that speaks for itself, that it must have had quite a beneficial effect that I'm, you know, functioning.
Making lives meaningful.
So we'd like to now welcome our special guest for this program, Dr. Simon Ranagal. He is a retired psychiatrist with over 30 years of experience working within the NHS. He is particularly keen on patient-centered care and a holistic approach to helping those suffering from mental health problems. So, welcome.
Hello, good afternoon, Argo. Thank you very much for inviting me to participate in this wonderful event for World Mental Health Day.
And thank you so much for your time. To appreciate in your busy retired post-retirement schedule, you managed to make some time for us. So really, we much appreciate your time.
My pleasure, my pleasure.
So perhaps we could start focusing on the socially disadvantaged group who are struggling with their mental health, and just wanted to know, what's your view on the accessibility to appropriate mental health service when they need them?
Yes, I mean, this past 18 months has been very challenging, obviously, for those with mental health problems in particular, and also for those of us trying to deliver mental health services and making sure that they can be accessible. Those, as you say, those who are socially disadvantaged have found it even more difficult and more difficult to access the services that we can provide, particularly in the way that we normally provide them. And I think that in a service that requires face-to-face consultation as being essential to diagnosis and treatment and therapy, this has been particularly challenging. For those who have been more socially disadvantaged, things like accessing technology and learning how to use technology in order to have online consultations, remote consultations, that's been very difficult. And I know within the NHS we have provided some of those more seriously unwell patients who have had difficulty accessing the services with some iPads and iPhones and other technologies, and tried to make sure that they could use them. But it's still been very challenging for us in terms of really picking up the subtle nuances that sometimes people can present with mental health problems, in order to make sure that they get the right diagnosis, the right treatment, the right help that they need.
Absolutely. Such a vital point to mention, Dr. Ranagal, because, we take these things for granted. We believe that everyone has got online, everyone has got access to laptop,
Not everybody
iPad.
has.
No, that's right. So, and, even coming all the way for the face-to-face assessment, sometimes financial challenges, public transport not easily available, not everyone has got car,
yes.
fuel cost. So I think that, we need to think as a professionals, as a mental health service widely, that what can we do to address these issues if we need a well-being or the globally, not just in this country, really, because I think even in this country, I've seen the challenges.
I mean,
so,
I think.
Yeah.
Sorry, I was just going to say,
No,
a
sure.
lot of the people who are more socially disadvantaged don't have English as their first language, and that's been another issue, because where we would normally perhaps have a translator coming in, that then complicates the picture even further with a three-way video or telephone consultation. And sometimes if the patients, particularly if they are paranoid or psychotic, then knowing what's going on and understanding it and being able to trust those people taking part is difficult. Also, the other thing that I was thinking about is for some of the socially disadvantaged people is they may be very worried about their homes and being seen on video within their home setting, where perhaps they can't afford to have a nice environment and they feel embarrassed or depressed about that.
Yes. And I'm sure that NHS is doing fantastic work with the limited resources. And
Yes.
you have got obviously a vast experience in working in this fantastic service in this country. But surely, talking about these challenges, how do you think perhaps we could improve on this, addressing these issues? Any
Yeah.
suggestions?
I think we have learned a lot during this pandemic, and hindsight is a wonderful thing. We obviously still do need to deliver some face-to-face services, and we need to be mindful of the fact that as service providers, we're also vulnerable during a pandemic, especially if we have underlying health conditions ourselves. So obviously the big issue about PPE and having enough of that ready for a pandemic, if it perhaps with hindsight that could have been handled a bit better, and also the other issue about training in order to use the technology, because I think we all probably remember the first time that we used things like Zoom, and you just see the top of people's heads, or people are mute and you can't hear what they're saying. So I think training, and perhaps even involving patients beforehand, training in using that kind of technology would have been beneficial. I think now we would be better prepared for another pandemic if one were to come, and more people will be used to using these technologies. And we've also discovered that there can be some advantages of using these technologies that may be able to help patients that can't get to see us face to face for other reasons, for physical infirmity, etc., etc.
Yes, and thank you so much for really bringing out the real perspectives from the socially underprivileged population. So I hope that our viewers and listeners have found it useful, and even people who are in the managerial roles, especially in the health services, we all ought to have some responsibilities and do something about it to address that. And as you said, it's a great learning curve for all of us.
Yes.
So once again, thank you very much, Dr. Arghya, for your time. It was a pleasure to have you on board.
My pleasure, and I look forward to the rest of today's meeting. Thank you.
Thank you. Thank you. Right. So hope that you found it useful. The last conversation focusing on the socially disadvantaged background the people are coming from. So, and we have heard from someone who was a psychiatrist, worked in NHS for a long time. So we now move on to our second guest, very special guest, Nabarupa Mukherjee. She's an engineer with MBA working for a global aerospace company in the UK. She is very passionate about singing. She's trained in Indian classical and Rabindra Sangeet. She has won multiple accolades in various music competitions, the latest being the British Indian Icon at International Indian Icon held in Chicago. She's also one of the former winners of multiple beauty pageants like Mrs. India UK, Mrs. Eurasia Earth International at Mrs. Earth pageant in Las Vegas. She involves herself in various community projects like autism awareness, plastic pollution, and support Calcutta Rescue Charity to help the underprivileged people in Calcutta. And the list goes on. So welcome, Nabrupa. We are so honored and privileged to have you today in the program. Thank you so much for your time.
Well, thank you so much, Dr. Sarkhel. It's really my honor, my privilege to be part of this great event that you have organized. And you probably know mental health is something that is very close to my heart. I personally get very involved with this topic, with this subject, and I'm really pleased that today is the World Mental Health Day, and I'm being part of this event that you have organized. So thank you very much for having me.
Oh, pleasure. So obviously, I know that you don't need any introduction. People have seen you, in lots of events. You have been involved with various webinars, talk shows on mental health. As a brilliant host, you met with so many professionals, charity workers, voluntary workers. Just wondering, what are your thoughts on the challenges that women face when it comes to seeking help for mental health?
Wow, that's a very interesting question, especially this year's theme being unequal world. Obviously, gender diversity definitely plays a big role in the context. So, women. Well, there are always challenges throughout the life, but if I particularly talk about, just as an instance, as within the Asian culture, um, a woman getting married and stepping into a different world, leaving her parents' home and moving into the in-laws' home, the expectations start building, and I think that is the time where the challenges keep increasing as the expectations start increasing, and then the expectation is really that you have now moved into a different family, so you have to adjust, you have to meet families' expectations to the
Yeah.
fullest. And with that, I think it becomes even more challenging for a woman then to look after herself. And again, if I just talk about the general statistics, then it's not really particularly for women in the Asian society. I think
Mhm.
it's women generally globally. If you consider, then you would see that on average,
Mhm.
it's women who are the main carers of children in the family. If the family have got older people, then also it generally becomes the women in the family, in the household, who become the main carers of the older people as well. And if a woman is professional, then obviously the expectation increases even further. You have to look after
True.
your professional world, and you have to meet your family expectations as well. And I feel that at some point, then it becomes difficult for a woman to meet or make everybody happy.
Yes.
And when you talk about the mental health challenge, I think that is the biggest challenge for a woman, to recognize that end of the day, I am a human being. I
True.
cannot be a superwoman. I can't make everybody happy, and it's okay to fail, but I need some time for myself.
Yeah. So
And
accepting that, isn't it?
absolutely accepting that, and then kind of trying to grab, even if it is 15 minutes, half an hour time from the day, trying to grab some time for yourself to breathe and give that time to yourself, the self care. I think that is the biggest challenge that women face when it comes to mental health. We are always in the kind of giving position, and sometimes we don't realize that yes, it's okay to share, and it's okay to kind of accept and overcome that challenge and overcome that barrier to talk about it and come out of it.
So me time, as you're saying, that me time is
Absolutely.
absolutely vital.
Absolutely. That
Fantastic.
me time. I definitely strongly believe in that me time. I definitely do that personally. Yes.
So, and I'm so glad that we are talking about it very openly. So I'm hoping that our viewers and listeners, you know, spread this message across. And just from the community point of view, any suggestion that you have, that what could we do from the community to address this issue? What can we do to make things easier for women?
I think definitely as a community we have got a very big role to play, and something like this that you have organized today, spreading more
Thank
and more awareness, talking more about the mental health issues and the challenges, and not just women but everywhere, like men, women, but particularly obviously you're talking about women to me, and I would say that yes, as a challenge, as I mentioned, that often women themselves become their own challenges at times, to acknowledge that. I think accepting that and talking it out. You have the family members around. You talk to them that you're struggling with the time. You want to get some time for yourself, and share that workload with other family members. Is very important, I feel. And we as people within the community, we have our friends and associates, sometimes even reaching out to somebody and asking questions, are you okay? Are you doing all right? That actually creates a big impact, because sometimes it generally kind of treated as a taboo that I don't want to talk about my mental health that openly. So if somebody asks you, you kind of tend to talk it out more easily. So
Yes.
being proactive and reaching out to people, your friends and associates within the community, is very important. I think we all should do that and look out and lend our listening ears. I think that is so important. Let people talk it
Yes.
out and listen.
And yes, I mean, obviously, as I'm just listening to you, the word that comes to my mind is healing. So, all the mental turbulence that we are talking about, the difficulties, we need to contribute something from the community to make the better place, the world, and perhaps contribute to the healing process. So, as
Yes.
you know, that obviously, as I've just said in the introduction, Naburpa is multi-talented, and so is her multi-talented daughter Pragya. So we'll have a glimpse of their performance, and again the message is about the healing. So let's watch their performance.
Mummy, you're back from work!
Yeah. Hey, what are you doing there?
Well, today's World Mental Health Day, so I decided to make a poster on it.
So how was school today?
Today's school was great. In assembly, our head teacher talked about respecting diversity.
Interesting. So what do you mean by diversity?
Well, there are people of different religions, different cultures, different skin colours, but we all need to respect that.
It's interesting, isn't it? Even in our own body, our hand has got 5 fingers. But are all these 5 fingers exactly the same?
No?
But we need all 5 of them to get our jobs done, and we can't get rid of any of them, can we?
Mummy,
Yeah?
I just had a great idea.
What?
What if we sing a song together to celebrate World Mental Health Day?
Hey, that's a great idea, actually. Let's get on with it.
Yay!
There's a place in your heart, and I know that it is love. And this place, it was brighter than tomorrow.
And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place.
Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me.
If you want to know why, there's a love that cannot lie. Love is strong, it only cares of joyful giving.
If we try, we shall see. In this place we cannot feel fear of dread. We stop existing and start living.
Then feels that always love's enough for us growing. Make a better world.
So make a better world. Heal the world. Make it a better place for you and for me and the entire human race.
There are people dying. If you care enough for the living, make a better place for you and for me.
Heal the you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. There are people dying. If you care enough for the living, make a better place for you and for me. There are people dying. If you care enough for the living, make a better place for you and for me.
What a lovely performance. A place better for you and me. Beautiful message. And I love that analogy of 5 fingers. We need everyone. We need everyone from whatever background they come from. So thank you so much, Pragya and Nabrupa, for that lovely performance. So let's move on to our next guest, who is another professional consultant psychiatrist, Dr. Mridul Banerjee. We are very delighted to have you, Dr. Banerjee, on board. If I just may say a few words, she is a consultant psychiatrist in Wales. She manages a mental health service for the over 65-year-olds. She was recently recognized as a fellow of the Royal College of Psychiatrists for her fantastic contribution to mental health services. Although she is working for the mental health services for over 65-year-olds, but she's actually got the dual training both in adult and old age psychiatry. So very knowledgeable, vast experience in NHS. Alongside her clinical work, she does oversee supervision, training, and creation of treatment protocols and mental health policies. She has got a special interest in young onset dementia. In her free time, she likes to spend time reading and likes photography. She's fairly involved in cultural activities. She's herself a trained Kathak dancer, and we might be lucky enough to see a glimpse of that later on. She loves to perform whenever time and energy permits. I have to say that during this particularly pandemic, she has taken part in both local and international webinars to discuss the impact of COVID-19 on mental health and on managing the consequent psychological distress, both in general population and in the ethnic minority groups. So welcome, Dr. Banerjee. We are very delighted and honored to have you on board. Thank you so much for your time.
Thank you for inviting us, Dr. Sarkhel. It's an absolute pleasure and very humbling to be a part of this program, especially on World Mental Health Day. And the previous speakers have been fantastic, and the little program that I just saw was absolutely fantastic. So once again, thank you so much for inviting me.
Our pleasure. Pleasure. So thinking about the diversity and unequal world, and thinking about different age groups, particularly for the elderly people that you are heavily involved with when it comes to their mental health difficulties, just wanted to know your thoughts as a consultant psychiatrist, that what are the barriers that you have observed in your clinical practice for this particular vulnerable group when it comes to accessing the mental health services when they deserve?
That's a very relevant question, especially relevant for me because I'm quite passionate about the mental health in older adults, mental health in everybody really, because every age matters, every mind matters.
Absolutely.
I suppose with the elderly, what I have to say is that they are no less prone to mental illness than our younger adults, and so it is particularly important that we make sure that there is an equitable distribution of whatever mental health related services, awareness that we do. I think your question is extremely relevant because I have seen lots and lots of barriers. And particularly so is the big thing that sticks out is stigma. I suppose, especially stigma is across the age groups, but in this age group, there's what we call the cohort belief that we have to deal with it quite stoically. We have to deal with it because we've dealt with so much in our lives. And at this stage in our life, why do we? It's almost seen as a weakness and a failure, which isn't really. So I suppose stigma would be for me, one of the ones that would be top of the list. And of course, then there is lack of awareness. What happens is lots of people think, oh, it's part of natural aging. I just have to get on with it. I've got to put up with it. There is a lot of sense of uncertainty. When I go there, will somebody listen to me? What happens if they don't understand my problems? And I think one of the salient things for us dealing with people over the age of 65 is a lot of people think that it's to do with their physical health. So if there is any pain that's not being managed by physicians, it has to be physical. It cannot have an element of psychological element to it. So it's that sort of general feeling that it surely isn't happening to me at this age. I'm quite strong. And the other thing is barriers to accessing services. So if you can look at somebody with sensory deprivation, like hearing, can't see, limitation in terms of mobility, transportation. Sometimes if you're living on your own, you can't drive for whatever reason. But I think there's quite a lot of those sort of functional issues as well, which would stop them from actually seeking. And I think
And I'm so glad, Dr. Banerjee, you talked about a very, very sensitive issues here and very, very pertinent. One is this feeling of being weak. When we have physical health issues, we don't particularly see it in that way. But suddenly in the mental health community, there's a perception, or people who are suffering, oh, it's all due to my fragility, I'm in old age. But, I think we have a lot to offer to educate the community, as we are doing now, having the discussion. That is nothing to do with the strength or weakness. It can affect anyone. And as you said, just like young people, younger adults, older people, they can also suffer from mental illness, but the treatment is available. And the second thing I really liked, what you talked about, those simple things we take it for granted, the vision, the hearing. So anyone who is out doing the assessments or planning to do an assessment, it is so vital, isn't it, Dr. Banerjee, that we need to address those issues first to get a quality assessment done in mental health.
Absolutely. I think brain health for everybody is equally important. One of the things that I've noticed in terms of just going back to the barriers is the fact that even GPs in primary care, people feel that what's the point of referring them for psychological services? Can they access? Can they remember? It's just not for them. Which is that ageist discrimination is something that is a big part of not just stigma but of lack of awareness, which you rightly pointed out.
Yes, and I'm hoping that viewers and listeners, who are watching this program, will spread this news, spread this message around in the community. So, coming from the professionals, or also perhaps some role in the community, how do you think we could address this quite a serious matter, really, that we need to do something about it?
I think the pandemic has shed light that not only do we have to look after our physical health, our mental health needs to be equally, looked after, given importance, planned. And as they say, WHO has actually accepted the fact that after the physical health related issues with the pandemic, we'll have a mental health crisis. So I think this is a pertinent time to discuss this.
Absolutely.
And as professionals, what I can say is that the main key thing is to reduce the stigma. And we can do that by educating, by raising awareness. And we have lots of important roles to play in that. One of the other things is not just about improving awareness in the general population. It is also healthcare professionals, so we can deal with it. We can spread a positive message across. We can make services accessible so that there's an equitable distribution. From the general population, what I would say is that just be aware of it, educate yourself. If you are going through a down patch, just take it as seriously as you would do if you had aches and pains in the body or something physical health was going on. Acknowledge it. Don't just shy away. There are help there. There is the other thing is that I would say is for those who are not suffering from mental health, please be sympathetic. Please be compassionate. Treat mental health as you would treat somebody who's undergoing some sort of physical health treatment. Take them with you if they can't go on their own, especially with the elderly, as we're talking about them. Often they will shy away. Often they'll have lots of other issues. Just sort of saying that you are as valuable to us as we would, for anybody younger. And another thing for everybody, I would say, especially the older people, is that try and engage yourself in activities in as much as you can. Try and look at a support group, but engage in activities that could be, sort of increasing the value that you have out of your life, spending time doing pastimes with your grandchildren, but also listening to music, doing art. That will release your happy hormones and chemicals.
Correct. And so while talking about, yes, so while talking about the music and arts, and also talking about spreading this positive message, why don't we have a look at one of your and Ritija, your daughter, very talented, your performance, just to send the same message to the community.
Thank you. Thank you so much.
তোর সাথেই তে পারতাম মোর মনের প্রজাপতি নাচি নাচি ঘুরি ঘুরি উড়ি উড়ি উড়ে যায় মন হারানোর ঠিকানায় আগুনের মোহনায় মন মাতানো মহুয়ায় রঙ্গিনী বিহুর নেশা কোন আকাশে নিয়ে যায় আগুনের মোহনায় সুরের অন্তরে ঝিরঝিরি ঝরনা ধারায় নতুন রং ঝরে রাঙা মোর কবিতা সুরের অন্তরে ঝিরঝিরি ঝরনা ধারায় নতুন রং ঝরে সবুজে সবুজে হৃদয় কেমন করে সবুজে সবুজে হৃদয় কেমন করে ও মোর দিন উড়িয়া যায় রে দিন উড়িয়া যায় বন্ধের তোর ভাবনা গুনগুনিয়ে যায় রে গুনগুনিয়ে যায় ও মোর দিন উড়িয়া যায় রে দিন উড়িয়া যায় বন্ধের তোর ভাবনা গুনগুনিয়ে যায় রে গুনগুনিয়ে যায় তোর স্বপ্নের ভ্রমণী মোর প্রেমের প্রহরী তোর স্বপ্নের ভ্রমণী মোর প্রেমের প্রহরী হৃদয়ের বাগিচায় নাচি নাচি ঘুরি ঘুরি উড়ি উড়ি উড়ে যায় মন হারানোর ঠিকানায় আগুনের মোহনায় মোর মাতানো মহুয়ায় রঙ্গিনী বিহুর নেশা কোন আকাশে নিয়ে যায় আগুনের মোহনায় আগুনের মোহনায় মোর মাতানো মহুয়ায় রঙ্গিনী বিহুর নেশা কোন আকাশে নিয়ে যায় আগুনের মোহনায় আগুনের মোহনায় আগুনের
That was absolutely brilliant performance by Dr. Mridul Banerjee and Ritija Biswas. So we'll move on to our next guest, Dr. Raja Biswas. He's a consultant physician for the care of the elderly in Royal Glamorgan Hospital in Wales. He is passionate about providing a service that recognizes each person as an individual with unique needs, which as healthcare providers, we should strive to deliver. Since March 2020, he has been involved with COVID as a frontline clinician, working in a COVID ward, and as a clinical director in medicine, organizing services to be delivered in the hospital for this patient group. He's also passionate about Black, Asian, and minority ethnic BME colleagues in NHS. He chairs the network supporting BME community in his health board in Wales. He's involved in print and television media on health-related topics. I know that he has done various interviews on health topics in UK television channels like ITV. So we are very honored, privileged to have you, Dr. Biswas, on this program celebrating World Mental Health Day. Thank you so much for your time.
Thank you, Dr. Sarkhel. It's a pleasure and honor for me to be here. Thank you very much for inviting me.
So perhaps because we have spoken to a few psychiatrists so far. So the patients with physical health problems, as you are a physician, how difficult do you find, for them to accept any associated mental health difficulties, particularly these elderly group? Particularly, I'm probably talking about more chronic health conditions like diabetes, arthritis. You deal with them day in and day out. But when it comes to chronic mental health conditions like depression, some anxiety disorders, how difficult do you find it for the patients to accept them?
It is a challenge. I won't say it is an easy thing to accept, because when most patients present to us with a physical health problem, especially chronic physical health problem, thing like pain or diabetes, the mental health component is quite an important part of it. And to understand that, and unless you can treat the mental health side of things, often the physical side does not improve. Unfortunately, that acceptance that there is a mental health element to the treatment is very difficult sometimes to communicate, or to families and patients to accept in the when they initially consult.
So, and I'm so glad that, especially coming from a physician like yourself, you're vastly experienced and qualified, and talking about the integration of physical and mental health. And I'm sure it's also equally important when it comes to the treatment of those conditions, isn't it?
Of course, it is very important. And the biggest example of that is chronic pain syndrome. And chronic pain syndrome, a lot of it is to deal with depression, anxiety. And unless you do anything about the depression and anxiety, the pain is not going to be controlled by tablets or anything else that you can do. All it does is you start having side effects from the medication, and you don't get the response. So you're not really treating the underlying cause, but just treating the symptom of your anxiety, depression, and it's presenting in the form of chronic pain. Similarly, sorry, go on.
Yeah, no, carry on, yes.
Similarly, sometimes the understanding of management of chronic conditions like diabetes. Why is someone not controlling their diabetes? There might be other elements to it rather than just inability to do it. So trying to get to the bottom of it is often a very important thing to control the diabetes or other chronic health condition.
Yes, and I think that, I'm so glad that we are now talking very openly in these forums. And I think for the viewers and listeners, taking on board this important information that health consists of physical health and mental health.
Absolutely.
And as you said, the tablets might be just one part of the care plan. We need to address the mental health issues. We need to treat them, perhaps sometimes by talking therapy. And And maybe just your views about role of counseling or the talking therapy for particularly these elderly group who are suffering from chronic health conditions with their
Mm.
mental health issues.
It is absolutely quite crucial because in UK especially, and especially in the last 1.5 years, 2 years since the COVID has been come in, there has been a lot of depression and anxiety because of the isolation that people have had.
Yes.
Not able to speak to people, not able to interact. Ultimately, human beings are a social animal. And if
Yes.
you put them in a room and with no chances of interacting with anyone else, it will have an effect. It will impact on their mental well-being, and that will be manifested as a physical health problem. So you are not treating the underlying cause. So at the end of the day, that is quite crucial in managing overall depression, anxiety, and the physical health.
Yes, and obviously, we stigma is a huge issue, as Dr. Banerjee also said before you, that is perhaps sometimes we feel it's our weakness or it's an
Mm.
elderly, it can be happen just due to the age. So, especially coming from a physician's perspective, any message to the community, how we could fight this stigma.
Um, in my experience, the first thing which is to be done is to acknowledge the mental health side, not to hide it, not to brush it under the carpet. Uh, Equate the physical and mental health at the same level. So, we give a lot of importance to physical health, but whenever there's something about mental health, we tend to brush it aside or try to hide it. There's nothing to hide about a mental health. If there is a mental health issue, yeah, we should be more open about it. And as you had mentioned in my introduction, that I have a lot of interest with Black, Asian, and ethnic minority
Yes, yes.
uh, background people, and I find that this kind of stigma is more in the BME community than in the Caucasian population, where seems to be a much more acceptance about the mental health issues.
Yes. So, and I think what you're talking about, that we need to really generate or instill the hope, and perhaps to enhance the self-belief system, that
Yeah.
we can improve our quality of life. Doesn't matter what background we come from, what gender we belong to, what socioeconomic status, and that's we're talking about mental health in an unequal world.
Mhm.
So, but with that, may I just thank you. We are very privileged and honored, really, to have you. And I'm sure our viewers and listeners have found your information valuable. So, thank you so much for taking the time, especially in your busy schedule.
Dr.
Thank you.
Sarkar, it's a great honor, and I just want to say one thing.
Yes.
I just want to thank you very much. I want to thank you and Malini for everything that both of you are doing, and I think it's a great privilege to be in your show. Thank you very much for doing this.
Our pleasure, absolutely, Dr. Biswas. Thank you so much.
You're welcome. Thank you.
So, with that, uh, what we talked about, hope and self belief, let's watch a video. It was a song sung by our very near and dear, we call her Nightingale, Tirna Mukhopadhyay. Let's watch the song.
Like a small boat on the ocean, sending big waves into motion. Like how a single word could make my heart open. I might only have one match, but I can make an explosion. And all the things I didn't say, breaking balls inside my brain. I will scream them loud tonight. Can you hear my voice this time? This is my fight song. Take back my life song. Prove I'm alright song. My power's turned on. Starting right now, I'll be strong. I'll play my fight song. And I don't really care if nobody else
and sleep. Everybody's worried about me. In too deep, say I'm in too deep. And it's been 2 years, I missed my hope, but there's a fire burning in my veins. I still believe, yeah, I still believe. And all the things I didn't say, breaking balls inside my brain, I will scream them loud tonight. Can you hear my voice this time? This is my fight song. Take back my life song. Prove I'm alright song. My power is turned on. Starting right now, I'll be strong. I'll play my fight song. And I don't really care if nobody else believes, 'cause I've still got a lot of fight left in me. A lot of fight left in me. Like a small boat on the ocean, sending big waves into motion. Like how a single word can make a heart open. I might only have one match, but I can make an explosion. This is my fight song. Take back my life song. Prove I'm alright song. My power's turned on. Starting right now, I'll be strong. I'll play my fight song. And I don't really care if nobody else believes, 'cause I've still got a lot of fight left in me. Now I've still got a lot of fight left in me.
Superb, wasn't it? That was really superb. And what? The fight, self belief, and hope. That's what we need to instill in the community. So, if we could now move on to our next guest, very, very special, and Rebecca Cude, one of our service users. I am so happy and honored that she could make her time today. She is a financial regulator, ensuring that financial service market provides good outcomes for consumers. So you can see that quality assurance is at her heart. She's also mom of 2.5-year-old little boy, and she tells me he is a real live wire. She suffered with both anxiety and depression throughout her teen and adult life, suffering sometimes debilitating mental health flare-ups. And I'm so glad that she is now in open discussion in this community webinar to help our viewers, listeners, and to the wider community. So thank you so much, Rebecca, for coming to this program.
Thank you. Thank you for asking me to be part of it. I'm really honoured to obviously to share the information and be part of this. So thank you.
Yes. So maybe from service users' perspective, obviously you are at the receiving end. What are the challenges you have faced when you first asked for help for your own mental health difficulties? Perhaps if you could share.
Yeah, of course. So I think for me personally, it was something that was quite new to me at the time, and I found it quite difficult to bring that out in my workplace and amongst my peers and with my friends as well. I think very much because my personality is quite naturally outgoing and bubbly. Sort of, I had a lot of, oh, I wouldn't expect that from her sort of thing. Yeah, my work weren't generally that supportive, and it sort of, I bought into this stigma that I think is still about at the moment, that to ask for help and to have a mental health problem is perceived as weak. And I felt sort of almost embarrassed, you know, that I'd said, I'm suffering these things and I'm feeling these things and I need some help.
And you're so right that, you know, that is a very, very big barrier, isn't it? About fear of being judged. You know, what's my family is going to think of me? What's my employer is going to think of me? So yes, you're quite right. And And I'm sure that you told us before that it did affect your almost all spheres of your life.
Absolutely. So I'd previously lost a job through mental health, so my performance dipped, and the management team, I suppose, instead of working out why that was, it was more of a case of, oh, her performance dipped, we need to sort of let her go. And I'd had quite turbulent and toxic relationships, both friendships and relationships. So after I actually reached out and sought medical help, that's when I was able to, I left a couple of my friendships that were toxic, and it led me to meet my now husband and obviously get my wonderful son, which obviously I'm eternally grateful for.
Yes, yes, and you know it's so important that we start openly talk about it, because it's not just treating those symptoms. When it comes to assessing someone's mental health or treating, is actually improving your quality of life. That is what we are aiming for. It is not just targeting those symptoms.
Yeah.
So, and it's nothing better than coming from this, hearing your first hand experience. So when the right help was available, how valuable was it for you, and what impact did it make in your quality of life, Rebecca?
Okay, yeah. So I just thought I'd begin by explaining what help I've accessed and what's helped for me. So I have a mixture of therapy and medication.
Yes.
So both of those together have just been an incredible help. As I said, it's changed my life. It's enabled me to form healthy attachments, healthy relationships. I'm now holding down a job, and I'm really successful and have a very open dialogue with my management about mental health, and have almost helped them to educate themselves about what support I need and that they can apply that to other colleagues.
Yeah. And here is a concrete evidence we could hear from Rebecca, who was at the receiving end, struggled with her job, struggled with her social life, family life, and the right treatment was available for her, and it was a transformation for her. So I'm really grateful to you that you are openly talking about it. Not only we are making it clear that what a big impact it had, but also we are fighting against the stigma. It's all right to ask for help, wasn't it?
And also our right not to be judged when we ask for that help.
Yes. And so, as you said, that one of the things I want to really talk to you, that when we talk to people, our patients, service users, any medications, particularly for mental health, there is a lot of misconceptions out in the community. Oh, it is addictive. Oh, it is unsafe to take. Or how long we have to take. Perhaps if you could just tell us what's the reality, what's the real information, because you have taken them and you're still taking them.
Yeah, no, of course. Like, they're fantastic help for me. So I actually feel no side effects. I very much notice if I haven't taken them. Yeah, they're not addictive at all. I've found them to be really easy. As I said, I'm a really busy full-time worker. I'm a mum, I'm a wife, and they play no other part in my life apart from to help it. There's no issue with taking them. I've also successfully come off of them for a short period of time to have a successful pregnancy, and
Absolutely.
working with you, Dr. Sarkhel, actually avoided postpartum depression. So for me, that was a major risk factor in my pregnancy. So to work with you with a mixture of medication and therapy, and be able to work with the medication as well, it's been fantastic to avoid that as well.
Yes, and I'm so glad that you mentioned that, because sometimes in the bigger, very very big mental health services, if you're doing very well, it's perceived that, oh, you don't need to be followed up, or you don't need to be reviewed by psychiatrists regularly.
Mhm.
But if we can hear from you that yes, you have been stable, but you're still being reviewed regularly by psychiatrists, how important was it for you for this regular review when it comes to prevention of future big relapses?
So absolutely. So if I can go back to sort of perception of mental health, I think that there's a perception of you have a mental health crisis, or you have mental health issues, and that everything will stabilize and you will go back to having no mental health whatsoever. But I don't think that's a feasible thing. So for me, I understand that this is always going to be part of my life. So instead of trying to get rid of it, I need to understand it and learn to live with it. So it's always up and down. So we work together, don't we? So I have a lot of self-awareness from my therapy and obviously my sessions from you. that I can recognize my triggers. And when I've got very much built up my self-awareness, so I can notice subtle change in my mood and my emotions and resultant behavior and think, wait, hang on, these are showing me small signs now that I'm starting to slip back. So I can speak now with Dr. Sarkhel, and we can intervene to stop it getting to a point where it's more difficult to come back from.
Yes, and while talking about the triggers, I think it's absolutely vital for our viewers and listeners to understand that is timely and early intervention is absolutely vital. So crisis intervention team, home treatment team, they're available in the many mental health NHS trusts, but it's very important to seek for the help at the right time, because you have seen, Rebecca, when there were little episodes when things had just started building up, that's the time you needed support, not to wait till things start go out of hands.
Yeah, absolutely.
So
Absolutely.
so any message from, as a service user, for
Yeah.
the viewers, that's something about stigma, asking for help and not to feel shy about it. So
Yeah, no,
what's your
of course.
message to the community?
So basically, as well, like I know that mental health issues have been brought to the fore a lot more, obviously, with the coronavirus pandemic and the additional struggles that we've had for that. But I just want to say to everybody that although there may still be some stigma in society that you're weak for asking for help, actually, that's a really brave and strong thing to do. I know now that without that, I don't know. I definitely wouldn't be on this journey now where I'm balancing being a full-time worker, a mum and a wife. And I just think it's so important, and it just shows it's a sign of strength. And a thing that I've learned, any therapist or any psychiatrist that I've worked with or come across, they will listen to you without judgment. And I feel there's a lot of judgment out there still in some cases. Obviously, we're doing a lot of work to rectify that. But listening to professionals that just don't do any judgment, and they just make you feel normal and what you're going through, they normalize it and they make you see light at the end of the tunnel. So
Yes, and what you just said, that, and I suppose from the community point of view, I'm sure you agree that perhaps also we, from the family member, from the carer, we also, if you can lend our non-judgmental ears, I think that will facilitate, for us who are suffering from mental health problem, to ask for help in a very
definitely.
safe and confident manner.
Yeah, and interestingly, you should say that once I started opening up to both like my colleagues, my close friends, and my peers, I actually found that a lot of people were feeling similar things to me, and
Right.
and the judgment did go away. I just think it's about being open, and you actually realise how many people are suffering similar thoughts and feelings to yourself.
Yes. So once again, we are very grateful to hear a very, very positive message from you, talking openly about your own mental health issues. And I'm sure that audiences, the listeners, the viewers have found it extremely helpful. So thank you so much, Rebecca, for your time. We are very, very grateful for your time today on this event.
Hey, thank you very much for having me, and it's a fantastic event. So well done for setting it up, and I'm really happy to be a part of it.
Thank you.
Okay,
Pleasure.
thank you. Bye.
Bye-bye. That was really, one of the best discussions I had, particularly from someone who is at the receiving end. So we now move on to another professional, not psychiatrist this time, psychotherapist, Antonia Ballantyne. Unfortunately, due to unavoidable circumstances, she could not come live today, but she has sent her audio clip, which we are going to play shortly. But let me introduce Antonia. Antonia works as an accredited psychotherapist in Living Mind, mainly working with adults. She has a wealth of experience and a passion for improving the lives of those she works with. Her experience has been extensive, covering a broad body of work with varied and complex client groups. She draws on various therapeutic approaches to support the specific needs and goals of each client, integrating various therapeutic methods, which is one of the key things for Living Mind as well. So she does use relational therapy, psychodynamic psychotherapy, humanistic therapy, person-centered approach, gestalt approach, transactional analysis, and of course EMDR for trauma-focused therapy. She treats most of the conditions like OCD, personality disorder, problems with self-confidence, low self-esteem, PTSD, and mood disorders, you name it. And, I can tell you that I had some good experience of working together with her. There have been many, many successful outcomes. So, one of the questions first I asked her that as a psychotherapist, how do you see the role of culture when it comes to engagement in talking therapy? So let's listen what she got to say about it.
The role of culture in therapy is extremely important to understand. In an unequal world, the ability to access psychotherapy resources from those from diverse backgrounds and cultures can be challenging. In recent decades, there is growing understanding in the West of mental health difficulties. This is helping to reduce the stigma that can still exist when someone within a family or community admits to seeing a psychotherapist. Families and communities often feel this in some way reflects badly on them, perhaps suggesting that they have failed this person, which brings up feelings of shame. This belief is not accurate. As a psychotherapist, it is essential for me to gain as much insight into the culture of each person I see, to ensure I can offer a treatment approach that respects their cultural and religious beliefs. Positive outcomes most often depend on the skill of the psychotherapist and their ability to view each person as a unique individual with their own cultural history. In many cultures, there is often distrust around disclosing private information about oneself and family to an outsider. It can help to settle people's worries once they realise that everything is confidential, as confidentiality is the first principle of every psychotherapist, regardless of their theoretical approach to therapy. All cultures have their own highly structured traditions, practices, and norms within which they create a sense of belonging. These can be based on religious beliefs or simply shared experiences which form the foundation of agreed practices. Within each culture, there are subcultures. Each family is its own subculture. My approach is to see each person as completely unique, to work alongside them, to see them as a person first, rather than looking at their ethnicity, their culture, their religion. First and foremost, they are a human being who needs the love, support, and protection of a fulfilling, comforting relationship with a psychotherapist that can help them to find their own solutions within their own cultural understanding. And my job is to help them to learn to pick up the tools that are appropriate for them so that they can move forward with their lives and overcome their difficulties.
I thought that was really extremely useful information about the culture, subcultures. So I then asked her that how can we, the people in the community, can facilitate this engagement? People from same culture or different cultures, helping them to engage in the talking therapy. And let's hear from Antonia.
In the community, it would be helpful for those who have benefited from psychotherapy to share their experience with trusted others within their culture. This can help to demonstrate how effective psychotherapy can be for assisting people in overcoming their difficulties and for better managing their emotions going forward, using the tools that best work for them. Fostering an atmosphere of inclusion for all in psychotherapy is essential within communities that have many diverse and varied cultures within them. The UK is known to have the most successful, cohesive, multicultural society in the world. It is within this cohesion and integration of cultures that growing understanding and acceptance of help through psychotherapy can continue to expand.
Again, another very useful piece of information. And please don't worry who are missing out on this program live. It will be in the YouTube, so you can always go back and listen. So we now move on to introduce our very close and special guest. Well, I shouldn't really call guest because he's in collaboration with Sangeet Foundation, and he is the man, founder, director of Sangeet Foundation. So he's Jayanta Ray. He's a senior IT professional and musician. He, along with his wife Nupur, has founded Sangeet Foundation that aspires to create awareness of and showcase the power of music and the arts as a complementary therapy for people suffering from plain unhappiness to the more clinical mental health issues like autism, ADHD, anxiety, depression, etc. He stayed in various countries, including Singapore, Brunei, Hong Kong, and the United Kingdom, apart from India. He is currently pursuing a research on creating community resilience through creative arts on digital media, drawing up his experience on doing approximately 100 programs on Sangeet Foundation. And I'm delighted to say I am also one of the trustees of Sangeet Foundation. Extremely happy about Jayanta's passion, really, to promote the awareness of mental health. So let's watch a video of Sangeet Foundation first and see what a fantastic work Sangeet Foundation is doing.
This is a charity which I have set up, and my motto is happiness through music and the arts.
It's basically our baby. It's more my husband's brainchild.
So if you talk about happiness, happiness is a state of mind. Dig a bit deeper, it's about mental health.
Because we are big time into music, we love our music. So we just thought, why not combine the two together and see what we can come up with.
And it has been proven that music can help in addressing mental health issues.
I think Sangeet Foundation is doing wonderful work in the area of mental health.
Namaskar, I am Bikram Ghosh, and I'd like to congratulate Sangeet Foundation for the wonderful work they're doing.
Let us all get together because Sangeeta Foundation believes in the fact that we can all get together by supporting the performing arts and music. Don't forget about that, please, because music brings the world together.
Sangeet Foundation aims to create awareness about mental health in the South Asian diaspora and use music and the art forms to create this awareness.
I'm very proud to be associated with Sangeet Foundation, who are working relentlessly to increase awareness about mental health through music.
A very warm hello to everyone at Sangeet Foundation. I, Ramanjit Kaur, wish you well on World Mental Health Day.
Sangeet Foundation. All of us require good mental health. We need to support this cause.
Music can give you immense happiness and love. So always be in music.
इस संगीत फाउंडेशन में हमारे साथ जुड़िए और इसका हिस्सा बनिए, इसको शक्ति दीजिए.
Hello.
Hello.
Welcome, Janto. Sorry, I shouldn't really introduce as a guest because you're also one of the hosts.
Absolutely.
So, and I was just saying that really admiring your passion about awareness of mental health. So, thank you so much for taking the time. I know you're very busy doing lots of different programs, and so just really wanted to talk to you about role of friends, family. That what can we do as a friend or family member, perhaps, to fight against the stigma associated with mental illness? What's your thoughts on that?
Right. So before that, Argo, this obviously that you've organized this and along with Sangeet Foundation, this is fabulous. And to all the, and I've been listening in into the performances and all the discussions. It's really lovely to understand and hear from the others about their perspective of mental health. Now, so going into, what about our friends and family and how they could deal with it. There are three very powerful words which we can always use and which is always useful. And those three powerful words are I love you. And I think, if we are able to express that to our children, our parents, our spouses, cousins, uncles, where there's a mental health issue, even though we may not understand about mental health as such, but it is about the acceptance without being judgmental, without judgment. What the previous speaker Rebecca just said, mentioned that. So without judgment, if we are able to support that person, I
Yes.
think that is a starting point. And that I have learned the hard way because, as you know, I have
Yeah.
been through a personal journey with my daughter where, when I first heard of it, for me, it was absolutely foreign. And I said, these are, I mean, I said, these are all Western concepts. It doesn't
Yes.
happen in Indian household, right? Like a good Indian father, I said, just focus on your studies. You will be fine.
Yes.
But it took me a while to understand, to appreciate, and to acknowledge that there's a problem. And that's a starting point of the healing. To say, yes, I acknowledge that you have a problem. Because otherwise, what happens is in the child's mind or into the person's mind is a doubt to say, am I mad? Which is a big, big stigma.
Yeah.
Mental health. So I really, really reject the word mad because
Yes.
that does not help in any way. Because if you talk about madness, all of us are mad in
Yes.
certain ways, you see. And that acknowledgement is very important. And and we need to treat like we discussed about the five fingers, right?
Yes.
In the community, the
Yes.
family, the extended family is like five fingers, and nobody in the family is same as each other. Even though your background is the same, you may have been born in the same hospital,
Yes.
you may have to the same parents for that matter, and living in the same household, but no two person is the same. And
True.
so everybody is different, and you need to acknowledge that, and you need to help people to understand that and say I love you regardless, and that I'm always there for you. I think that is a very, very strong message which goes out, which helps people to say, yes, I have somebody, and that I believe can help save a lot of lives as well. And
Yes, and it's just such a good point you mentioned, Janto, particularly because you were also indirectly at the receiving end at some point. And
absolutely.
we talked about the struggle you had to get to the right help. And one is, of course, availability of the service at the right time. But secondly, even people who are suffering, facilitating that environment so that they feel not judgmental is not their weakness. It's
Absolutely.
nothing to be ashamed of. And more we talk about these routinely, especially from people like yourselves, and as a result, you form this, fantastic charity. I'm proud to be trustee of that,
Thank you.
because the passion is there, the aim is quite very, what I'll say, very noble. So really, I mean, when it comes to some of the treatment accepting, because one is about accepting the mental health problem, but I think there is another second set of problems, the acceptance about the treatment. Perhaps some thoughts on that about accepting the treatment for mental health, whether it's a medication or talking therapy.
So yeah, even before that, so between acceptance and treatment, there's another step saying that where do I reach out? Who do I reach out to? What do I ask? Right? What, and then the stigma of what will people say?
Yeah.
Yeah. So, and so why should I discuss it with somebody? Because my son, my daughter, my husband, wife will become coffee table conversation. And finally they do. But then we also need to realize that there is a sector where segment of people who are willing to come forward and help and advise and guide you. And unless you reach out, you do run the risk of being coffee table conversation. But then what it does do is what it has helped me with is to firstly to reach out and get connected with some really wonderful people, and one of them being you, right? So it has helped me to get to know so
Thank
many
you.
good people, and and to know that there's so much more beyond what you really knew. And this has
Absolutely.
really opened vistas for me, understanding mental health. And I always believe, when we talk about charity, I always believe that charity begins at home.
Yep.
So we must
Okay.
start with our home, with our family. If we can't help our family, there's no point in helping others. Right?
Yes, and for that, really, I'm very grateful that you talked about your first-hand experiences, and I'm sure the viewers and listeners have taken that on board. And as I said, it will be in YouTube. You can always go back and watch. And main thing is, please spread the message. Even one of you spread the message, I think we'll be delighted. So that's our goal, to have this kind of program. So thank you so much, Jayanto, for your time and very valuable contribution. And I know that even yesterday was at a doctor's event and you were asked to talk about mental health, and it just shows that people are listening, people are watching, and they are valuing your wealth of experience, the first-hand experience. So thank you so much, Jonathan, for that.
A pleasure. Thank you for having me.
Thanks. Right. So finally, we are now coming to the end almost at our live event. But as promised, we do have a surprise guest who is our very near and dear Shubhangi Mitra. I understand, unfortunately, she won't be able to come live on video, but she'll be talking to us. So let me introduce Shubhangi. MRFA Foundation, and you can visit the My Rising from Ashes. I think it's in her YouTube channel and is based in London, UK. She is on mission to spread the awareness of mental health, to eradicate the stigma associated with mental illness, promote mindful living. MRFA Foundation and Living Mind in collaboration have been working together, building strong-minded young people. The work involves giving seminars in different colleges, universities. So without further ado, let's welcome Shubhangi, who will join us through audio link. So welcome, Shubhangi. But I'm not sure if you can hear us. If not, I'm sure that we will, again, we'll have some conversation, and I will put that messages in our live event later on. Sorry that due to unavoidable circumstances, you couldn't make it. But again, once again, many congratulations, not just for winning these beauty pageant awards, but also doing a fantastic work in the community, raising mental health awareness. So we are concluding our World Mental Health Day celebration. I'd like to give vote of thanks to all our guests who took their time from their busy schedules, the viewers and listeners from all over the world. And I have to say, there are 3 people I ought to mention their name. Without that, this program would not be possible. If I could mention firstly Kaushiki Chaudhary, who has been or he has worked tirelessly for this program, doing all the background work from the poster, still looking after the social media. Malini, my wife, looking at the StreamYard, the backstage, and Che, our son, also looking into the timing and everything. So I'm very grateful to all of you. Jayanto giving me support as always. So all I can say, finish off with, please spread the awareness of mental health. Mental health treatment is available. It is important to acknowledge, doesn't matter where we come from, which background. Let's make it a fairer world. Let's make it a bit more equal access when it comes to treatment for mental health. So a big thank you to everyone. Happy World Mental Health Day 2021. And there we conclude our program. Thank you.